Hi, I'm Dr. Andrea Ulmer and I'm one of the veterinarians here at Wascana Animal Hospital. One of the things that I'm going to show you how to do today is how to give an insulin injection to a diabetic. So the same techniques are going to apply both to cats and dogs, but we're going to show you today using Big Mac here, our friendly little kitty. So one of the first things that we always need to double check is our syringes with the type of insulin that we're using. So we generally at Wascana Animal Hospital, the most common types of insulin that we use are either insulin glargine, which we use for cats, and that's 100 unit per mil insulin. And the other type is insulin, which we most commonly use in dogs, but there's still the occasional cat that might be receiving this, and that's a 40 unit insulin. So on the syringe here, you will see that it actually says U40, or on this one, for example, U100. And you always want to check the syringe against the bottle that you have to make sure that you have the right syringe for the right type of insulin, to make sure that we're not over or underdosing. So once we've determined that we have the correct syringe, the next thing is to be able to give the injection. So insulin is a sub-Q injection that goes under the skin, and generally in cats in particular, but also some dogs, they have the most extra skin up at the shoulder or scruff area. So you can see that I can gently pinch and make a little bit of what we call a tent here with the base, and then the top when we pull up on the skin. And when we give an injection under the skin, when we pull up, we want to have our needle go into where the base of the tent would be. Now, insulin needles are very fine, so sometimes it can feel like we may or may not be in the skin or that we're hardly giving anything. But remember, it's a very fine gauge needle with a very small amount of fluid. If you ever are in doubt as to whether or not you actually gave the insulin, we usually recommend that you do not administer a second injection right after the first one. If you think that you may have given some of it, but you're not quite sure, wait until that evening's dosage when they're due again to avoid overdosing them with insulin. So as you can see here, I'm going to spread the fur just so you can kind of see the skin. I'm going to gently pull up to make the tent, and then my needle is just going to go in the base of the tent and inject. And it's very, very painless because it's a very small, very fine needle. And then we want to dispose of that in a sharps container. Now, over time, especially with diabetics, because you're going to be giving quite a few injections, you do want to spread out the area that you are injecting so that we don't end up with a buildup over time of thickened skin or scar tissue, which would affect our absorption. So other good places or locations would be further over on the shoulders, here and here. Cats also tend to have more skin over the back end here where you can make a little bit of a tent. So I usually recommend that with each injection you pick a different location and kind of spread it out.